Hello, it's Dr. Rhonda Johnson. Today is Tuesday, October 19th, 2021. And today I'm going to be answering the question, are some COVID-19 vaccines better than others? Well, you probably have heard about this on the news, but a September 24th report published in the CDC's Weekly Morbidity and Mortality Journal showed that there was a difference in the effectiveness between the different COVID-19 vaccines currently in use in the United States. What the study did, they looked at 3,700 hospitalized patients in U.S. hospitals between March and August of this year who were 18 years and up and who did not have a compromised immune status. And what they found was that the Moderna vaccine was overall 93% protective against hospitalizations. The Pfizer vaccine was found to be 88% effective against hospitalizations, and the Johnson & Johnson vaccine was found to be 71% effective against hospitalizations. The CDC also found that the Moderna vaccine produced higher antibody levels against the virus post-vaccination than the Pfizer tech vaccine, and both of those are messenger RNA vaccines. And they attributed this difference to two possible reasons. One might be the dose, and the Moderna vaccine is 3 times higher than that of the Pfizer vaccine, and the spacing dose between first and second doses is longer. With the Moderna vaccine, it's 4 weeks instead of 3 weeks for the Pfizer. But they admitted that there could be other unknown factors involved too. And another highly significant finding was that people who were vaccinated with the Johnson & Johnson vaccine had the lowest post-vaccination antibodies to the SARS-CoV-2 virus. So the messenger RNA vaccines, both of them performed better than the Johnson & Johnson vaccine, and the Moderna vaccine performed better than the Pfizer vaccine. Now, keep in mind that this is real-world data, but according to the CDC, all of them provided substantial protection against COVID-19 hospitalization. So I know that was kind of scientific, so I want to break this down in plain language. So in plain language terms, your chances of staying out of the hospital if you get COVID infection are best if you got Moderna, followed by Pfizer, and lastly by the Johnson & Johnson COVID-19 vaccines, according to the CDC. So that answers the question, are some COVID-19 vaccines better than others? And better is in terms of preventing hospitalization. But I want to caution that these studies just measured antibody levels. They measured 2 different types of antibody levels. And no studies are really able to large scale measure cellular immunity, which plays a large part in the immune response as well. They're just measuring antibody levels in the blood over time. Now, I'm going to switch up a little bit and talk about the Johnson & Johnson vaccine. On October 15th, the FDA advisory panel unanimously approved a booster dose of Johnson & Johnson vaccines for all Americans 18 years and older who received their first single dose of the vaccine. Now, unlike the Pfizer and Moderna booster recommendations from the FDA, which are for high-risk groups only, the Johnson & Johnson booster recommendation includes anyone 18 and up who got the Johnson & Johnson vaccine and the booster should be given at least 2 months after the primary dose. Now, around 14 million doses of the Johnson & Johnson vaccine have been given in the United States. So 14 million doses for a single vaccine means the 14 million people who got the Johnson & Johnson vaccine have been approved by the FDA advisory panel to get a booster dose. But, again, that's just the FDA. The CDC will meet later on this month and do the recommendations for both Moderna and Johnson & Johnson now that it has cleared the FDA. To add to the mix, the FDA is now considering whether people can mix and match their COVID-19 vaccines. Now, this is really going to be pertinent to the Johnson & Johnson vaccine recipients, since this vaccine seems to confer the lowest immunity. Now, I understand, and I've heard this from many people, that their physicians are already telling people who got the Johnson & Johnson COVID vaccine to get a messenger RNA vaccine, and this is already happening in the real world, even though it's not recommended. So what's the bottom line here? The bottom line is that everybody who got a vaccination dose for Johnson & Johnson needs a booster. And if you're a Pfizer or a Moderna recipient, you only need a booster if you fall into a high-risk group. And if you're immunocompromised, you're eligible for a Pfizer or Moderna booster now. And you need not wait 6 months after your second dose. So if you are contemplating mixing and matching, folks, just wait until you get the official recommendation from the CDC. What remains unknown is how long these booster doses will last. And of course, the big $1 million question is, how long will this pandemic last? So I hope that clears up some confusion for someone out there. As always, my views are my own. I realize this isn't easy to try to understand. You should always talk to your doctor about which strategy is best for you. Stay safe, keep your mask on, keep washing your hands, folks, and have a blessed day.